HIV, we'll be detecting antibodies against this particular virus in the patient's blood or serum. In the first step, 3 drops of buffer solution is added into the sample test window of the test kit. We allow the buffer solution to soak through. The 1 drop of patient's serum is added into the sample window. Immediately after, 5 drops of buffer solution is added, followed by 2 drops of conjugate solution and allowed to soak through. In the last step, we add again 5 drops of buffer solution. The result of the test is read immediately after. Result interpretation. The kit that we have used here is based on the immunoconcentration method and it's called HIV tridot. And as its name suggests, either 1 dot or up to 3 dots can appear in the sample window. For valid tests, at least 1 dot has to appear at the area designated by the letter C. If there's no appearance of any dot at the control region that's designated by the letter C, then the test is invalid and should be repeated once again using the same test kit reagent from the same box or from a different box using the same patient sample. For negative tests, only 1 dot will appear, that is at the control region C. If the test is positive for HIV1, then 2 dots will appear, that is at the control region C and at the region designated HIV1. If the test is positive for HIV2, then 2 dots will appear, that is at the control region C and at the region HIV2. There are times where a patient may be positive for both HIV1 and HIV2, hence 3 dots might appear, that is at the control region C, HIV1 and HIV2 region.